Good afternoon, everyone. I'm Oliver Barnes, the HSN Network Programme Director, and I'm pleased to take part in the closing session of today to provide an overview of the NHSX Innovation Collaborative's achievements so far, alongside a forward look. I'll be joined by Tim Cullinan, NHSX Head of Delivery for the Digital Health team, who will be providing a regional overview of the remote monitoring programme's achievements so far, alongside a forward look for the coming year. To start, it will be great if colleagues could continue to share their thoughts from today's conference via the Slido link that members of the team have popped in the chat throughout the day. We very much welcome your thoughts and feedback.
Thanks, Oliver. Hi everyone, my name is Tim Cullinan. I'm Head of Delivery within NHSX, and my role is supporting the regions with the rollout of remote monitoring across the country. So really fortunate position to work with a huge number of very talented and hardworking people throughout our work in 2021. So I want to start really by saying a huge thank you and also a massive well done to all our NHS and care staff who've worked tirelessly in these really difficult times throughout the year. And the stage we've got to now, 7 months in, we're able to say that we've supported 794 patients at home. So to help illustrate the magnitude of that, this amazing effort, if we stood all those people in an appropriately socially distanced line, that line would go all the way from Wembley Stadium right up to the King Power Stadium in Leicester. So it's 98 miles of people, if you can imagine that. So it's really good work. We've got to lots of people, but I think that leads to a very important question of so what difference has it made? Really building on Roz's point earlier around remembering the reason that why we're here. So I'm just going to very briefly touch on the regional work this year from the lens of the impact it's had on the health system, staff, and people and their family and carers. So starting with impact on the health system. So it was at times of the greatest COVID pressure, people really stepped up and rolled out systems that have both prevented people going into hospital, also supported to get them home safely sooner where it's clinically appropriate. And as mentioned by Andy and others earlier, helped to reduce those readmission rates, crucially freeing up hospital beds so those patients at the greatest need could get into hospital beds when needed. It's also helped really build on the foundations for this new model of care, which has been touched on throughout today. So it's really built on that good work. There's a few quotes up on the screen there on the side. I don't know if people are able to see it, but what we've seen is some of the really good work in Essex is their work with care homes has helped reduce non-elective admissions by 8.9% when compared to care homes that don't have that technology, where their admission rates have gone up by 5.2%. So we can see a really positive change for patients there and the system as a whole. And we continue to work with them to make sure everyone can benefit in the same way. Moving on to staff, what we've really found is this type of technology has the ability to save clinical time, often in emergency situations. It's also really helped staff prioritise their patients while they're under a lot of great pressure. Another example of that is on the screen from the East of England. The care home manager described how paramedics now use this equipment to provide in-depth knowledge in emergency situations. So again, really positive outcomes for staff who've worked really hard under a lot of pressure. Finally, and definitely most importantly, some of the impact on people, their families and carers. So all know that being ill is frightening at any time, and I can only imagine what that must have been like in the past year with everything going on. So again, through the rapid and hard work of the NHS and care staff, patients have been able to feel reassured, and they've also described how the approaches can be quicker and easier and reduce stress and anxiety. A couple of examples on the screen there, one from the virtual wards work in the Midlands, where the patient felt they were more confident and supported, and another example building on the work in the North East around supporting people with mental health problems, where they found the new experience to be cause less distress. So really huge thank you. Like we said, lots of people, lots of good work gone, and it's a really positive picture that we're seeking to build on this year. Just pass you back to Ollie now, sorry. Thanks, Ollie.
Thanks, Tim. There are 4 key areas of work that have made up the overall programme content so far of the Innovation Collaborative. Those being events and networking, which has included a series of national events to share insights, progress, achievements and challenges. This has been supported by a suite of thought leadership sessions that have been determined by Innovation Collaborative members to support providing them with practical skills, knowledge and expertise needed to support digital transformation. The 4 national thought leadership sessions centred around talking to the public about data, human-centred design in healthcare, introduction to social innovation and inclusive digital transformation. Demonstrating the benefits and impacts of the innovations has been a major focus of the Innovation Collaborative, which has led to the development of a health economics and business intelligence workstream. Regional teams have had access to expert advice, training and support on health economics and cost benefit analysis methodology to apply to their own projects in practice. The offer has included individual guidance for each regional project on measuring benefits and calculating return on investment based on local need, culminating in expert one-to-one guidance of over 300 hours of support. It has included a national benefits register, guidance documents, masterclasses, business case training, and rapid evaluations. The communications and marketing areas have been split into 2 work streams: products and case studies and communications. These areas have brought the work of the Innovation Collaborative to life by using compelling stories, case studies, and content that demonstrates the positive benefits and impacts the innovations have had on patients, clinicians, and services. In keeping with the ethos of the Innovation Collaborative, we've used creative approaches to engage, inspire, and build knowledge through a wide range of digital knowledge resources. It's worth noting that final case studies will start appearing on the Innovation Collaborative Digital Health Workspace Future NHS platform from next week, and members will be notified through the Collaborative's bulletin. If you haven't already, please do sign up to both the bulletin and workspace to engage, share learning, and have access to all the digital knowledge resources across the Collaborative's work streams. The business case training workshop resources on long-term conditions, deployment in care homes and mental health have also just been uploaded, so take a look at those as well. So what does this mean from a national engagement and activation perspective? Well, at the moment, we've got over 700 members on the Innovation Collaborative's Futures NHS workspace, 2,300 plus document previews, 900 plus document downloads, 400 members signed up to receive the regular bulletin, with an event reach of 650 registered attendees for this conference, 170 attendees at each of the last national events, an average of 85 attendees at the benefits masterclasses, and an average of 50 attendees at the thought leadership sessions. So some fantastic engagement so far. We've also received over 900 views on the first animation, with the second one being released today. As we know, engagement is not just about quantitative metrics and data. It's about hearts and minds. Across the Collaborative, what's been fabulous to see is the connections people have made from the national event chats to the thought leadership sessions, to the health economics and business intelligence masterclasses, podcasts, Future NHS workspace and beyond. It's not us, it's you, the health and care workforce, that makes this work. A learning system can only work with engagement, peer-to-peer sharing, and a community of shared purpose. And we've certainly seen this. It's been fantastic to see the community growing at pace throughout the Innovation Collaborative's development in this first phase. We look forward to building and welcoming colleagues to continue on the journey as we collectively move forward into the next phase. Please do access and share the learning resources. They're there to support and be used for maximum benefit to health and care.
Thanks, Oliver. So yeah, I'm just going to continue by talking about some of our work as we move into 21-22. Again, really excited about this work. What we're doing with this year is really looking to build on the really positive work which I described earlier. So to do that, we're going to focus our work in 3 focus areas. They are the care sector, which includes care homes, domiciliary care, and supporting people with learning disabilities, long-term conditions and virtual wards, and supporting people with severe mental illnesses. So what I was just going to do quickly is run through some of the high-level plans within these areas and some of our cross-cutting themes, which we'll cut through in addition to those. So firstly, in terms of the care sector, I'm delighted to say that the care sector work, which featured in all 7 of our NHSIE regions last year, we'll do so again this year, but hopefully reaching a significantly greater scale of patients. And what this work will do is it'll expand on the work of last year, but with some new and additional work around frailty pathways, falls prevention, and as I mentioned before, domiciliary care and supporting people with learning disabilities. And I think a key element of this, and I really like the way Dr. Shannon Gray talked about it on the panel earlier, is around developing skills, confidence and tools for those care staff who do an incredible job. Having worked in a care home myself previously, I know what a challenge that is, but what a rewarding challenge it can be when you give them the right tools. So that continues to be a really good programme of work for us. The second is around long-term conditions and virtual wards. This again will build on a lot of the rapid work this year, which was done as part of the COVID response. It falls into two main areas really. The first being the ongoing monitoring of people with long-term conditions. So using digital solutions to monitor people's time, monitor people's conditions over multiple time points rather than just a one-off annual review. And hopefully that helps get a better view of what people's individual normal is and allows for a more informed conversation between health professional and person. So, and within that, we've got quite a range of conditions, but I would say there's a strong focus on respiratory diabetes and heart failure this year. The second part of the long-term conditions virtual ward piece is more around the virtual wards. And this is where we're really looking to see how this type of work might impact on bed days. So it's where patients may otherwise be in a hospital bed during a period of exacerbation when they could, supported by our technology, be safely and appropriately supported at home. We know there's some really good work in this area going on in Norfolk and Waveney. We know Northamptonshire have also done some really good work in this area, and we seek to learn from them, build and share. The third area is supporting people with severe mental illnesses such as schizophrenia or bipolar disease, who compared to the general population are at double the risk of obesity and diabetes, 3 times more likely to smoke and face a shorter life expectancy between 15 and 20 years, which I think we all agree is pretty sort of shocking and totally unacceptable. So whilst this is a relatively new area to our programme of work, it does build on some really exciting work in Oxfordshire, which involves tech-enabled annual physical health checks, including point-of-care blood tests for patients. These have been reported to be quicker, easier, reduce anxiety, and crucially help to facilitate a conversation around health and lifestyle. So really positive in terms of the opportunity there. So our 3 areas being care sector, long-term conditions, annual physical health checks for people with severe mental illness. Cutting through all of that work, we've got at least 3 cross-cutting schemes. The first, and it's come out loads today, which I'm really pleased about, is a conscious consideration of health inequalities, inclusive digital transformation and digital poverty. So the work in this space around remote monitoring is described obviously really well by Ros and others, has both the ability to reduce but also exacerbate these issues. So we've got a dedicated work stream for this year, and that will help us ensure we take concrete actions, building on some of the work that Ros described. Our second cross-cutting element is around working in partnership for a more joined-up approach. So we started this year with working really closely with social care colleagues, health colleagues, and I think our next step really is to expand this by taking on more and more views of staff, people and service users, as we've started to do. And I think Lauren gave a really good example of this with the work around involvement of people in her discussion earlier. The third one I'm going to mention, the final thing from me, is around continuing to learn and evolve. So Matthew's presentation spoke a lot about the need for this to be a sustainable model. So what we really want to do is to ensure that we build on the amazing hard work so we can get as maximised benefit for the health system, staff, and most importantly, people. So this is our work this year, and as I hope you can tell, really excited and looking forward to it. I'll hand back over to you all.
Thank you. Building on the energy, enthusiasm and positive feedback during phase 1, the plan for phase 2 is to continue to develop and deliver the National Innovation Collaborative. The aspirations for the forward look are focused on the ongoing development of a wide-reaching learning system across health and care in England to promote increased interest and uptake in technology to support people at home, an energising and engaging programme of events that highlight achievements and challenges, providing thought leadership opportunities, continuing the development of the Innovation Collaborative as a community of shared purpose, encouraging learning and sharing from each other, understanding and sharing improvement methodologies, development of tools and templates to support scale and adoption, whilst also building the evidence base to champion technology-enabled remote monitoring. A golden thread throughout all this is the sharing of human stories alongside the programme journeys. On behalf of the HSN network, I'd like to thank projects and the wider workforce teams for the fantastic achievements in technology-enabled care that have taken place in a very challenging period. We're really excited and looking forward to continue to support peer-to-peer learning in the spread and adoption of innovation to improve population health through this next phase of the Innovation Collaborative. Thank you very much for taking the time to attend today. I'll now hand over to Breed, who will officially close the show. Hope everyone's enjoyed themselves.
Thanks, Oliver. Wow, what a day it's been. I hope you've all managed to take away some valuable insights and inspiration from what you've heard. I certainly have. I think I said earlier in my conversation with Tim that I was excited about the opportunity we all have to work collectively. And I think having listened to Joe, that's really put it into perspective. We really have got something that can make a difference here for our patients and our staff. I'm not quite sure how best to summarize the key points because there are so many, but I'm going to give it a go, and very happy. It would be wonderful in the chat if people could put what actionable insights they've taken from today, or what's your key takeaway message, because that's sharing those sort of things are really important. So for me, I've heard, let's be clear about what we're trying to achieve for our citizens and our staff. Be clear about why we're doing this. That comes back to a very well-known change principle of your common sense of purpose is what drives change. Matthew talked about this needs to be about sustainable change and creating new ways of working. And I think Joe reiterated that, and others have throughout the day. Let's not use digital to continue with the as is. Let's do like every other industry has done and use it to take us to a better place. But it's not about the technology. It's about rethinking how care is provided and indeed how it's funded. And also not making judgments about the appropriateness for individuals. I think COVID has taught us so much about don't make assumptions on behalf of anybody. So that's about assumptions about who it's appropriate for, but equally who it's not appropriate for. So that needs to be that partnership conversation between the patient and the clinician. Undoubtedly, we've heard throughout the day that clinical leadership is key, and it was great to hear from Natasha, Gareth and Vaughan on this. And I think that's an ongoing conversation in terms of how we ensure that is a really, really important component of how we work. But equally important is the deep engagement with users. We've heard that throughout the day as well, and we've consciously included patient stories in all our work because we are here to provide a service for our citizens, actually remembering the point earlier about that paternalistic model of care. I think for me, message from today, this is a cultural change program enabled by technology, which offers great opportunities for supporting patients at home, but also some new workforce opportunities. I think Joe mentioned about, retention opportunities for people who might otherwise leave the service but have so much to offer. And we've heard that as an emerging story from elsewhere. So that's a really important point that we need to take forward. Another point is that for me is the point that Megan made earlier, and Joe mentioned this as well. This is not just about stopping people going to hospital. This is about making sure the right people go to hospital. So it's not about avoiding admissions or A&A. It's about making sure the care is delivered in the right place for each patient. And hopefully for most patients, that's in the comfort of their own home. Alongside all of this, reflecting what I've heard from talking to teams on the ground, people really want to focus on optimizing the opportunity of what we've done to date and what they're going to do moving forward. And I think that means we need to build stronger relationships across the improvement community. An example of this is some work we're doing with the Q community through the Health Foundation. We want to be able to collectively support this work moving forward and to do get in touch if that's of a specific interest to you. But obviously we'll keep people posted. We'll be communicating with everybody who's registered for the event. So we will keep you posted on anything like this as it emerges. I think we've also heard a lot today about impact and really measuring impact. And I think that's about measurement for improvement and using some of that improvement methodologies there, but also building our empirical evidence base. And Andy talked about some peer-reviewed papers, and Matt did as well. And we do have to continue building that evidence base. So that will be a big focus for us this year, and eager to work with all our partners to build this and share. So just to reiterate a couple of things, the content from today, all of it will be available on this platform for the next 2 weeks, and we'll then move to the Innovation Collaborative NHS Future site. And we have taken on board the comments people made about subtitles, and we will look to address that. One of the presentations available on demand is a walkthrough of how to use the Innovation Collaborative NHS Futures platform, which I personally have found really informative. So I can recommend it. And thanks to Donna Clements for providing that. I'd encourage you to listen to our podcast series, which I know we've popped links into the chat, and watch what you missed today here on demand. So if you've had to pop out, we know this new world, people join for parts of the day. So you do have the opportunity to catch up and indeed to share it with colleagues. I'm delighted to say, and hopefully it's appearing in the chat now, the Partnership Award opportunity that Rod mentioned this morning, the details of that are now live on the NHSX website, and the link, as I say, will be in the chat. Again, another real opportunity to further improvement enabled by digital technology. So lastly, I'd like to thank everyone who's joined us today and become part of this journey, our participants and all our speakers. I want to pay a special thanks, reiterating what Tim has said, to the teams across the country who've been delivering real improvements enabled by digital technology for our patients during what's been an unprecedented time. It's been a real joy to work with you all, and we look forward to continuing the journey together. Also, a huge thank you to our AHSN network partners for really helping to create and build our Innovation Collaborative. And we look forward to continuing the partnership in the coming year. I can't finish without saying a special thanks to those who made today happen. Big thank you to Laura and team, to Joel and his team for their technical support in the background, plus of course to my team in NHSX. We would ask you to continue this conversation on the Future site or via Twitter using the hashtag that's now appearing in the chat. And we do want to gather feedback from anything you've heard today, including ideas or challenges, as Matthew mentioned. And you can email us on the Innovation Collaborative email. But equally, we want your feedback on today, so please do use the Slido. As always, the reason we do what we do is to benefit our citizens. So I'm going to reiterate the quote that's been used twice already today. And I have a philosophy that if I hear something 3 times, it's meaningful. So I'm the third person saying this. But a patient who is feeling really anxious about COVID, to be able to say, I can't express how fantastic a service this is. It was like having them in the room with you at your side. I never felt like I was on my own. That's why we do what we do. I hope you all have a wonderful evening, and thank you for joining us today. And I'm giving you back 5 minutes, the gift of time. Thanks.